Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, how can I tell if I have chronic stress, and are there any lifestyle changes that might help prevent chronic stress? Well, first off, remember that chronic stress is not all bad. Stress just simply means there's a change in your life, and your situations might be changing. You're enduring new challenges and expectations. That's not all bad. There is a movie, classic movie called Groundhog Day, a couple decades ago. Bill Murray was the star in it, and it basically was themed after a nightmare type of situation where a person was experiencing the exact same thing every day. In other words, he didn't have any stress. Stress just means change. Now, when we talk about problematic stress, that means you have change that is overwhelming your ability to cope based on your past experiences and your coping mechanisms. So a change that is overwhelming you, okay, that's the problematic stress. But stress itself is okay. So chronic stress where you're overwhelming your bandwidth of ability to cope and deal with the stress, okay, that's a problem. How do you deal with that? Number one, try to identify what kind of stresses that you're encountering, and take note of what you can change about those life circumstances and what you can't. If you're getting stressed out about what's happening in the Middle East and you're not in the State Department yourself and you can't do anything about it, that's nothing for you to be worried about and to be so-called stressed out about. So some people will find themselves getting stressed about situations in which they have no control. So number one, try to identify and write them down. What kind of changes you're encountering day to day, and then identify what you can do about them and what you can't. Many people will find that they have uncontrollable stress because they are procrastinating on things they don't really want to do, and then their deadlines are coming up to get these things done, and they feel overwhelmed and they can't sleep, which, by the way, is a means by which you can find stress intolerable, because if you lack sleep, the rational reasoning part of your brain starts to not work so well, because when you're sleeping, this front part of your brain rests, and in resting, it recharges, and you can think more clearly the next day. If you're thinking about all these changes and these stresses going on day by day, and you're ruminating and dwelling on them, and you can't sleep, that will affect your ability to reason through your life circumstances and the difficulties that you're trying to endure. So what you want to do is list out the different stresses, identify what you can and cannot do about different stresses, the stresses in which you can find some control over them. By all means, try to do something about them and give yourself a game plan on what you're going to do about them. Now, we'll always talk to people about watching your diet, because many people are stress eaters. If you're a stress eater, you're going to be prone, not uncommonly, to gravitate more toward carbohydrates, especially refined sugars, where you're giving yourself a blast of carbohydrates, and in doing so, you're increasing your insulin. Increasing insulin will temporarily throw more tryptophan into the brain. Tryptophan is a building block for serotonin, and that feels good for a while, but then you crash. So refined carbohydrates, the sugars out there, aren't good for you when you're stress eating, but many people instinctually will stress eat. Try to eat more protein and try to limit your diet the best you can. Intermittent fasting for many people will work out during this time, where they skip breakfast, they just eat a moderate lunch if they can get by on that without binge eating, and try to eat moderately during about a 6-hour time window during the day. What else can you do? Exercising is fantastic. Any kind of physical movement can help you deal with stress. stress. Many people will notice when they get headaches and tension, aches in their shoulders and back, they do really well with some kind of resistance exercising, which means lifting weights. And doing so under a supervised kind of setting can be very helpful. And moving around, aerobic exercise such as walking, running, bicycling, elliptical machines, anything you can do to get the heart rate going can be helpful, because when you increase the heart rate, you're releasing a little protein in the heart that actually goes to the brain and decreases their likelihood that you'll be overly stressed out. So there's a lot of things you can do about chronic ongoing stress. Now, chronic stress that's what we call unmitigated, where you're not dealing with it so well, chronic stress is not good for the brain. It actually physically makes the little neurons of the brain shrivel up. So you got these neurons, especially in the front part of the brain and in the hippocampus area, the memory center of the brain over on the temporal lobe, they will shrivel up. They don't die. The neurons don't die, but they shrivel up. And it's kind of like a plant that needs more fertilizer. So instead of having 50,000 branches, it might only have 30,000 branches. So you need more branches on your little neurons. And when you're under chronic stress, or you eventually get to the point where you have clinical depression, those little neurons start shriveling up and they lose their branches. So what we're trying to do in the treatment of depression and people with chronic stress is we're trying to make their little neurons more fluffy. And in doing so, we have medications now that kind of will infuse natural miracle grow into the brain and allow you to have more fluffy neurons. It's called brain-derived neurotrophic factor. BDNF is a means by which you can make neurons more fluffy. So newer treatments coming out now for depression, which is often due to chronic unmitigated stress, will actually make neurons more fluffy within a matter of hours based on animal studies. Thanks for your question. Let's go to our first caller. Hello, Doug. Welcome to Matters of the Mind. Hello, Doug. Oh, you want to know what are the benefits of the new antipsychotic Cobenfy for schizophrenia? Cobenfy is a medication that affects acetylcholine, also known as muscarinic receptors, Doug. And in doing so, it's an entirely different mechanism of action than we've been addressing for schizophrenia for the past 6 decades. So about 6 decades ago, you had this brand new medication. It was an anesthetic discovered by a French anesthesiologist called chlorpromazine. Chlorpromazine is also known as Thorazine, and it was the first antipsychotic, and it was used as an anesthetic, and they noticed that when they gave it to people who had impaired thinking with delusions, hallucinations, what we now know as schizophrenia, they actually had a relief of their symptoms. So in the 1950s, 1960s, you had a lot of people who were psychotic and they were institutionalized in state hospitals. They were released from the state hospitals because they could take medications like what we now know as Thorazine and other antipsychotic medications that came out thereafter. So since the 1950s, 1960s, all we've had for schizophrenia are predominantly medications that block dopamine as their main mechanism of action for relieving the delusions. Delusions are fixed false beliefs that can't be possibly true. And hallucinations, those are called so-called positive symptoms. Positive symptoms are not good symptoms. They are symptoms that are very prominent, and most people on the outside can tell there's a big problem there with these people. So the dopamine blocking agents would primarily relieve the so-called delusions and hallucinations. Then in the early 1990s, clozapine was the first of the newer so-called atypical antipsychotic medications to come out. They block dopamine in this limbic system area on the side part of the brain, but they also block serotonin 2A receptors in the front part of the brain. If you block serotonin 2A receptors in the front part of the brain, you release dopamine in the front part of the brain. That can help with motivation, concentration, and just brighten you up quite a bit. So that was a second mechanism of action we had starting about 20, 30 years ago. So that's where you're blocking serotonin receptors in the front part of the brain to increase dopamine in the front part of the brain. Now we have this newer medication, Cobenfy, that is a medication that is affecting acetylcholine. So we're not talking about dopamine anymore. We're not talking about serotonin anymore. We're talking about acetylcholine. It's an entirely different mechanism of action. Now, are there downsides to it? Sure. I mean, as a downside, you can have difficulty with constipation, fast heart rate. People can sometimes have puffy skin. They call it angioedema. And if your liver or your kidneys aren't functioning so well, you don't want to take it. It can, in some cases, be associated with liver damage. So we have to be careful with liver and kidney functioning, but if used for a healthy, otherwise healthy individual, it can be a very safe and effective medication. But the excitement in psychiatry right now, Doug, is that it's an entirely different mechanism of action compared to anything we've had since the 1950s. Doug, thanks for your call. Let's go to our next caller. Hello, Shelley. Welcome to Matters of the Mind. Shelley, you want to know, are vivid dreams an indication of possible mental health issues? Maybe, Shelley. When you aren't sleeping so well, you'll often have a rebound effect where you will sleep more deeply and you actually can have more dreams. Now, historically, we've always heard that people with clinical depression will have more dreams. They'll start earlier in the night and they'll be more intense. You can have scary dreams, which can be associated with post-traumatic stress disorder, PTSD, but scary dreams are not diagnostic of PTSD. In other words, if you have scary, frightening dreams, it does not mean you've been traumatized. That was a misperception about 30 years ago that has since been debunked. So if you have bad dreams, yeah, it could be from sleep deprivation. Maybe you're going through some tough times in your life. Dreams are symbolic, they're abstract. In other words, they aren't, actually writing the play of what's actually happening in your life. They're very, very symbolic. So they'll be symbolic of what might be troubling you or what you might be thinking about during the day, but they aren't giving you necessarily a predictor for the future, and you shouldn't read too much into them. Try to think about the underlying meaning of the dreams themselves. Thanks for your call. Let's go to our next caller. Hello, Marcus. Welcome to Matters of the Mind. Marcus, you want to know, why does stress make you sleepy when you feel overwhelmed? All you do is sleep. Yeah, we call that difficulty with stress resilience. Stress resilience, Marcus, is a target symptom that we are now trying to identify more in psychiatry. There's a scale, there's a 5-item scale, I believe it is, called a brief resilience scale. And a brief resilience scale basically is examining how well you're able to put up with stuff every day. So if you're struggling dealing with things day by day, and it's called difficulty with stress resilience, you'll notice that your brain has to work a lot harder. You're thinking more intensely. You're trying to work through your problems, and you're really firing up this dorsal lateral prefrontal cortex here when you're trying to think through problems, and it can make you tired. When this part of your brain gets tired, what happens is, if you think about an automobile driving down the road, it releases exhaust fumes. The exhaust fumes in the brain is called adenosine. You might have heard of ATP. ATP breaks down to ADP. ATP is the fuel of the brain. That's what gets the brain energized. It's the fuel. Well, ATP will release exhaust fumes, and it's called adenosine. When adenosine builds up in the brain, it'll make you tired. That's why people find benefits when they drink coffee. Caffeinated coffee with caffeine will mimic adenosine at the adenosine receptor in the brain, knock off adenosine, and thereby make you more awake and alert. So that's why caffeine in slow forms, I'm not talking about caffeine tablets. I certainly don't recommend those because they get in your body, they go to your brain real fast, and then they're gone, and actually you can feel worse with caffeine tablets. If you sip on caffeinated coffee over the course of 2 or 3 hours, over the course of time, you can give your brain a slow marination of caffeine, and in doing so, the caffeine is competing with the adenosine at those adenosine receptors. When adenosine stimulates those receptors, you feel tired and sleepy and you can't think. When caffeine goes to those receptors, it knocks adenosine off, and then you feel more awake and alert. And this is why, for many people, caffeine can be helpful. What else helps? When you're stressed out and you're feeling sleepy, take a 20-minute nap. It can do a remarkable job in re-energizing the brain. And it's kind of like giving your brain a little bit of a boost of a battery recharge, because when you sleep for 20 or 30 minutes, once again, you're knocking off the adenosine, your brain is recharging. And when it recharges like that, you're able to better think through your difficulties and be able to download memories and thoughts more efficiently. This is why I'm often recommending to medical students who I teach to try to get a 20-minute nap, 30-minute nap toward the end of the afternoon, maybe early evening, before you do your evening studies, because you'll be able to download information so much more easily. So adenosine is the exhaust in the brain that makes you tired and sleepy. Caffeine will knock off the adenosine receptors, and of course, sleep. A brief nap will help you reset those receptors as well and allow you to feel less stressed out and be able to think more clearly. But when you're not sleeping so well, which is happening so often, Marcus, when people can't sleep so well, they get overly stressed, they have difficulty with stress resilience. Difficulty with stress resilience then gives you difficulty with sleeping, and it's a vicious cycle. So what you want to do is try to get those naps in and think through your difficulties the best way possible. Marcus, thanks for your call. Let's go to our next email question. We have another email that came up here. It reads, Dear Dr. Fawver, I get headaches when I'm having anxiety, and is there a correlation between headaches and anxiety? There is, because when you get headaches related to anxiety, what's happening is your skull, all around your brain here. It's a thick skull, it's hard. What happens is your muscles, which are very thin muscles, all around, especially your temporal areas and your occipital area in the back there, they're very thin, and they will squeeze down, and in squeezing down, they can give you this tightness all around there. If you have a headband-like headache that goes to the back as well, that's called a tension headache. If you have a migraine headache, that's occurring on one side of the brain or one side of the head or another. A migraine headache will be sharp, intense, will often make you need to go lay down and sleep it off. It's incapacitating. A migraine will often be accompanied by nausea, not uncommonly, sometimes even vomiting. So that's a migraine headache. A sinus headache is where you have tenderness above the sinuses, above your eyes typically, or right below the eyes. You'll often have nasal congestion, and very commonly a fever associated with that. That's a sinus headache. And then you can have what's called a temporal headache, where you have difficulty with a headache occurring at the same time of the day, typically around the same time of the day, or being a 4 o'clock headache or a 5 o'clock headache. It will give you a pinpoint-like pain just below the eyeball, give you watering of the eyes, give you a red eye, and that's more common for people who have difficulty with smoking. People might have some hormonal changes. People who drink alcohol periodically will have that kind of headache. But that's the kind of headache that occurs pretty much the same time every day for many, many people. So there's different types of headache. A tension headache is where you have this outside squeezing on the skull itself, and it's called a tension headache. What can you do about that? One of the best things you can do about that is exercising. If you exercise, many times you can relieve a tension headache. And that's the difference between a tension headache and a migraine headache. If you have a migraine headache, if you exercise, it's going to be incapacitating. You won't be able to do it. Tension headaches, you actually feel better when you start exercising. And for that reason, I'll recommend that people exercise if they have tension headaches, shoulder aches, low back pain. These people often need to move around some, exercise, aerobic and anaerobic, where you do the resistance training. Those type of exercises can be very, very good for any muscle-related aches that are related to anxiety. Thanks for your email. Let's go to our next caller. Hello, Cindy. Welcome to Matters of the Mind. Cindy, you want to know, why does your brain fill in missing letters in incomplete words? Because your brain, Cindy, kind of has been there before, and it kind of knows the path. So it's kind of like walking down a trail in which you're very familiar, or even walking in your house in the darkness. You know the path, so you are kind of going to go through that direction. Your brain will do the same thing. And that's why when we read quickly, when we skim information, we're often reading right down the middle of the page, perhaps, and you can kind of pick up a lot of the message, and you can pick up the theme of the story itself. Even though you're not reading it letter by letter or word by word, you're kind of filling in the blanks, because your brain has been there before. It kind of knows the territory. It knows certain words will go together. I hear a lot of this type of phenomenon occurring with musicians. Musicians won't read note by note by note. Musicians will start thinking about chords, and they'll start thinking about patterns of the music itself, as opposed to looking at note by note by note. That's the way our brains will operate. Our brains like patterns, and if you're familiar with patterns, your brain will kind of fill in the blanks. Thanks for your call. Let's go to our next caller. Hello, Beth. Welcome to Matters of the Mind. Beth, you want to know, does attention deficit hyperactivity disorder or other mental health disorders prevent someone from forming deep relationships? It depends, Beth. A part of having a mental health disturbance, a psychiatric disturbance, will be what's called functional impairment. If you don't have functional impairment, where you have difficulty with relationships, work, social, academic difficulties, you got to have some kind of difficulties there related to those symptoms you might be experiencing, including ADHD. Yes, that would be a significant impairment. So with ADHD, the problem that people may notice is they will often lack tact, because they will say and do things they ordinarily wouldn't say or do. They just kind of blurt things out. And they will often come across to some people as being uncaring. For instance, their loved one might ask them to do something or remember something, and they forget because with ADHD you have a difficult time downloading information that you are having problems in which you're processing because you have limited attention span. So you can have difficulty with relationships related to mental health issues, and part of the treatment will be, number one, correct the underlying neurobiology disturbances that are causing this mental health problem and psychiatric disturbances, but also having some coaching and psychotherapy, talk therapy can be helpful in helping you identify where and why you might be having these relationship difficulties. Beth, thanks for your call. Let's go to the next caller. Hello, John. Welcome to Matters of the Mind. John, you want to know, are omega-3 fatty acids really beneficial to brain health? If so, what are the benefits? I'll give you a definite maybe there, John. I think there's been a lot of discussion about omega-3 fatty acids for the past 30 years. And I always will tell people, you know, if you really want to know what supplements you should take, ask your clinician, your nurse practitioner, your physician, what they take as supplements. And what I hear about omega-3 fatty acids, I hear a lot of doctors, for a while they might take them and then they don't take them. And they don't notice a big difference many times when they do take them. I think omega-3 fatty acids have better research with heart health. So if you're going to take an omega-3 fatty acid versus an omega-6 fatty acids, which is thought to be detrimental for some people, omega-3 fatty acids can give you greater benefit for heart health. Some for brain health, because keep in mind that 60% of our brain is fat. So if somebody calls you a fat head, they're actually giving you a compliment, because that's a good thing for your brain to have more fat in it. And 60% of it being fat, much of that is related to omega-3 fatty acids. So if you're having a deficiency in omega-3 fatty acids, sure, you can have some difficulty with having some of the fatty effect on the brain itself. There were studies years ago looking at Japanese women who ate a high level of fish, and they had higher levels of omega-3 fatty acids. And based on that study, it was found that they had a 50 times decreased risk of postpartum depression after they delivered babies. So that was thought to be a possible signal that, hey, maybe those omega-3 fatty acids can really be helpful for depression. I haven't been as impressed as I would have liked. Otherwise, as a clinician, I'd be taking omega-3 fatty acids every day myself. I'll do it off and on. I do it more for heart health, but they can possibly help with brain health, but you probably won't notice a dramatic difference if you were to start omega-3 fatty acids unless you were significantly deficient of it. And that's the only way you know. You try a supplement of omega-3 fatty acids for maybe a month or so and see how you felt. But most people won't notice a meaningful difference. 20 years ago, not uncommonly, clinicians would recommend omega-3 fatty acids as a supplement, and you know, that's an extra expense. And what people would often do is they'd pay for their omega-3 fatty acid supplement, but they wouldn't pay for their prescribed antidepressant medication. So they often wouldn't get the benefit they otherwise would have had. Thanks for your email. Let's go to our next caller. Hello, Kenneth. Welcome to Matters of the Mind. Kenneth, you want to know, is there a link between vision loss and social isolation and depression? Not only vision loss, Kenneth, but also auditory loss. So if somebody is losing their hearing, they will be more socially disconnected, and it can give you, in doing so, more social isolation and possibly depression. Vision loss, it depends on how gradual it has emerged. If you were in a horrible automobile accident, you all of a sudden lost your vision, the ability to adapt and cope to that change could be a precipitant to having more depression, where you'd feel demoralized, you'd have lack of motivation, you wouldn't find interest in things and so forth. So if it's a gradual vision loss with a condition like macular degeneration, for instance, that's something in which you might find that you can adapt easier than if you had sudden vision loss. It's not uncommon for a lot of medical conditions to present that way, where if you have a medical condition and it's an abrupt change in your ability to function, you're more likely to have difficulty to have the coping bandwidth in which I referred earlier to be able to tolerate that stress. If you are overwhelmed with something that's occurring very, very suddenly, you're more likely to have difficulty with tolerating that particular stress. So acute stress where it's overwhelming and you're finding difficulty finding the coping means can give you a higher likelihood of depression in many cases. Thanks for your call. Let's go to our last email. Our last email reads, Dear Dr. Fawver, what can I take or do to help ease my fear of flying? In terms of taking any medication to ease your fear of flying, it's a common strategy for us to give somebody just a very small dosage of alprazolam, also known as Xanax. You just take it while you're in the terminal itself. You're getting ready to board your flight. You're at your gate. They announce your gate. They say your flight's ready to go. You take a little bit of a Xanax during that time if you're not prone to addiction. And we're only talking about just taking it before a flight. Now, here's the most important thing. As you fly more and more, chances are you'll become more adaptive to it. Now, why are people often anxious about flying? For one thing, you're in this metal fuselage inside the plane and you're totally helpless. You are over a mile up into the air, so if you experience turbulence, which is kind of like going over a bumpy road, that can be scary for a lot of people. Keep your seatbelt on so you don't get bouncing around and hitting your head on the ceiling. But turbulence is not something that usually leads to planes crashing. The crashing occurs at liftoff and during landing. It's not when you're well up in the air when you can often have that turbulence. So understanding what's happening when you're up there, some people get kind of freaked out when they hear the wheels get more engaged and they hear that grinding the wheels coming back in. Understanding what's happening around you in flight can often be helpful. My younger daughter's a flight attendant. They explain that type of thing to people all the time, so that could be helpful for you. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at mattersthemind@wfwa.org, and I'll try to get to the question in the next program. God willing and PBS willing, I'll be back again next week. You've been watching Matters of the Mind on PBS Fort Wayne. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.